I'm Dr. Adriana Potter, and on Let's Get Physical today, we're gonna try to get rid of the morning stiffness on our backs and other joints of the body. As we age, arthritis will always set no matter what you do, and that stiffness is really annoying early in the morning. So let's get started, and I'm gonna show you simple stuff to do it, and we can do it along if you wish to, okay? So when you wake up, most likely, you're on your back, okay? So if you're laying down like this, and if you're like, oh, I'm hurting, right? You start with bending your knees, and start with some pelvic tilting. Flatten the back, arch the lower back. So you're doing a little bit of that tilting motion on your pelvis to start waking up your lumbar region, your lower back region. So you do about 10 repetitions of that rocking back and forth, flattening the back, arching the back, flattening the back, arching the back. Alrighty? The second one, we're going to start with the knee motion. So you're going to rock your knees right and left about 10 times. Just kind of lengthening a little bit that spine, bringing some fresh blood supply in that. And you should go in pain-free range motion. Should not be painful as you move your knees to the right. And depending how much limitation you have or how much muscle guarding you will have less motion. The goal is to be doing this and the pain is either staying the same or decreasing. And also try to find that if the pain is decreasing, your knees are going further away, all the way to the other side. After the 10th repetition, and if you feel like, oh yes, I can stay in here, you keep your knees to one of the sides. And if you feel like your muscles are guarding, you can put a pillows underneath of it to keep your knees supported so you don't go as far, because the idea is to relax on this twisted bottom position for about a minute or so. We're not gonna hold this long in the video, but I highly recommend that you do that when you're doing it at home early in the morning. And after a minute, you can go to the center, do a couple pelvic tilt to neutralize that back, and then you go all the way to the other side. Use the support pillows if you need to, as long as you're able to stay there for a minute and you're relaxing and your pain staying the same or going down, decreasing it. We don't want to have more pain the longer you hold. If that's the case, this is not working for you and you should stop. Alrighty, after a minute, you're gonna come back to the center, and then you're gonna start with your bridges. So you're gonna tilt your pelvis, flatten the back, lift the hips up and down. And two reasons that you will not be able to lift high is, one is that you're already having range of motion limitation on your backs and hip, or you actually don't have enough strength in your gluteal muscles to lift your hips high enough. And it doesn't really matter how high you go. All that we want is just kind of going down, flattening, relaxing, flatten, lift, going up, round it down, flat and release, roll flat back down, lift the hips and up. So you're getting a little bit of that release into the lumbar back. So you're getting that rolling motion, rolling that way, rolling down towards your feet. Alrighty? And bring the rocking anytime you need. all right? Another one that we can do laying down in here is hugging the knees to the chest. If this is not comfortable, you can do one leg at a time, and you rock your knees side to side. And you can start with one leg first, about 5 to 10 repetitions, and then you do the same thing on the other side, 5 to 10 repetitions in here. And if you're able to do both, sometimes after one at a time you're able, and you can spread the knees out as much as you want to, because a lot of people have some midsection in there. So putting the knees far apart, like on a happy baby in yoga. So knees to chest, rocking side to side is just as good. So about that. And you can do some circles, clockwise and counterclockwise. Alright, those are the ones we're doing laying down on your back. If you are having some limitations on the range of motions, you can go to laying down on your stomach. Okay, and it might be that all that you can do is being in here, and you can do the same thing, bend your knees, rock right and left, trying to release a little bit of that pelvis. Okay, the magical number is 10. Of course, like I said, no pain or no increase of pain, because you're probably doing this because you have pain, but don't want the pain to increase as you're doing this. And now we can do the same thing. You can do the tilting, and if it doesn't feel good, don't do it. But what we're looking for is actually to go up into your elbows. And that will help you to get some extension on your lumbar and thoracic, which is the lower and mid back. And you can rock right and left. And it will also help your shoulder. So if you're having some stiffness in the shoulder, that will help you a little bit with that. And just breathe. 5 long, relaxing breaths. Letting your body just naturally extend in here. If this is feel good and you want to go up to the next level, what you're going to do, you're going to press this hand down, go up and down. And it doesn't matter how high you go. I always say go slow and small. And over time, you can go all the way. The hips stay down. And again, pain-free motion, or the pain is the same. No increase of pain as you continue with this exercise. So you're getting a little bit of extension. You can add the neck and down. Up and down. And try to keep the glutes relaxed, no squeezing of the butt. Try to keep this as relaxed as possible. We tend to try to extend on the spine by squeezing the butt. I discourage that. So you don't want to be squeezing the butt here. You want to be nice and relaxed and down. Alrighty. And you can relax in here for another few seconds. Rolling your shoulders. Always kind of get your bearings before rolling it. A lot of people want to do the following, which is a no-no when you're already having back pain, which is to sit up like this, right? That's not good for your spine. Your neck is tensing up a lot, and if you don't have a lot of strength, you are going to compensate and do things that are not good for you. So the best way to get up from the bed is to roll to your side. Use your elbows to roll it. Swing your feet off the edge. Use this hand and this elbow to push you to sitting and push yourself to sit. Alrighty. Once you're sitting in here, we can do a little bit this pelvic motion, which I call the pelvic dance. You're doing like a hula hoop on your hips and back, and reverse, and doing to the other side, about 5 to 10 motions in there. And then you can do the cat and cow. So stay with the knees off the edge. I'm gonna turn sideways so you can see what kind of motion is happening in my spine. But you don't have to do this and sitting crisscross. You can if you want to. But the cat and cow is like arching in here, flattening your back, arching it up, and looking up. So you're going, breathe it in, out actually, and breathe in. Open the chest. Breathe out as you close the chest. Breathe in as you arch and look up. Breathe out as you lean back and cave in. Breathe in and breathe out. You're more than welcome to do this in crisscrossing, but if that's not available to you, it's totally fine. Breathe out. To do on the edge of the bed. Breathe in and breathe out. So the next one we're going to do is getting a that rotation again. So the one hand is going to go behind your hip, the other one's go across your leg, and you're going to twist from the top. Think about twisting from your belly button, twisting that way. And if you want to add the neck portion, that's going to help with the stiffness in the neck. Look to the same side that you twist. And you stay there for a pretty good 5 long breaths. It's about 30 seconds or so. And after a while, keep the rotation on the spine, but look opposite to your rotation. So you look into the opposite shoulder. And you're doing that breathing in and out, letting the rotation twist you like a pretzel. Yes, but you will feel a lot less stiffness when you move. Okay, and after 5 long breaths or 30 to 60 seconds, you're gonna release in here, rolling on your shoulders, doing some side rocking on your hips. And repeat that to the other side. So one hand goes to the back, opposite hand goes across to the knee, twist from your belly button, and you rotate your body to the other side and look to the same direction of your rotation. And you're gonna practice that for 5 long breathings, 30 seconds or more. And then after that, you're gonna bring your neck to the opposite direction. You keep the twist in here of the spine, but your neck is looking opposite your rotation. In and out. Alrighty, and then you're gonna release, doing some of the pelvic dance and rotations. Sometimes when you work on the neck muscles, it releases the shoulder because a lot of the muscles that is attached to the neck is attached to the shoulder blade, which moves with your shoulder. Okay, so it's kind of that chain reaction. So you can bring your neck to the side, this head in here, this shoulder stays down. Very often it wants to come up and do this, and then you're losing the stretch. So I recommend you try to reach to the edge of your bed, whether you're able to grab something or not, but you're reaching down so it keeps the shoulder going downwards. And you just hold that stretching for about 30 seconds to 60 seconds each side. And you're gonna repeat that to the other side. 30 to 60 seconds on that side bending. So ear to shoulder motion. So it's getting straight in here on the side of the neck. Stretch. Alright. After 30 to 60 seconds in here, you're gonna, the chin, English. The chin is gonna come down towards the armpit, right? So you're looking diagonally down towards your hip. And this hand here, on the same side and deep bending, is gonna help your knee to come down a little, help your head. It will help your head to come down towards that hip. And the stretch is going to be more towards the back region of your neck. And you breathe in and out, 30 seconds or 60 seconds. You might be in the beginning. All that you can do is 30 seconds, and that's fine. And you're gonna release, roll it on your shoulders, and do the same thing. Chin down towards the armpit, head going down, and the hand on the same side bending, doing a little bit gentle pressure of the head going down towards the hip. And the hand is optional. You don't have to use the hand. You can just let it there. I like sometimes just having the weight of your hand just holding you there, because it will give a little bit gentle overpressure and promote a little bit more the relaxation. Remember, this hand here is going to be reaching in here down to the mat on this side, so your shoulder does not hike. It stays down. 30 to 60 seconds in there, and you release the motion in there. So back to the back, all right? So this hand is gonna come in here. This hip has to stay down, because sometimes when we side bend in here, this hip wants to go up. This hand will help me to push my hip down that way. So you're actually doing a lengthening in this area. The option is to reach your arm towards the ceiling, not necessarily doing this side bending. This is very advanced. You can just lengthen in there and keep the hip planted. Don't let it hike it up. So your weight should feel even on your bottoms when you're doing this side bending. And you can relax your head so you get to the neck as well, help with that stiffness. And I know that I'm giving a lot of options about how to get rid of this stiffness. It all depends what parts of your body are creating that discomfort early in the morning. So none of them are mandatory, of course. You can pick the ones you like the most and stick to them. Consistency is more important than just doing it hard, okay? You want to do gentle, but you do consistently doing it. When you're having a lot of pain and a lot of stiffness, it might take you a few times throughout the day to start making changes. And if you had range of motion limitation already, you probably should be doing this multiple times throughout the day, because you having more pain and decreased range of motion. So you want to add range of motion, you want to do this 3 to 5 times. If you are having just the stiffness, you do your 10 minutes in the morning and you may find out like, oh, this is good, I'm good to go. Alrighty, so that is the gentle stretches that you can do early in the morning, and you repeat that multiple times throughout the day as needed. There's no right or wrong, there's no limitations how often you should do it. If it feels good, it's working for you. If it doesn't feel good, please stop, right? One more time. If the pain is staying the same or decreasing, keep doing it. It will help you more. If the pain is increasing the more you do it, this is not working for you. Please stop and seek the help of a physical therapist to customize these exercises, modify according to your body's need. So thank you for watching the channel today. I am Dr. Adriana Potter. Let's Get Physical series today on back stiffness, how to get rid of your back stiffness. Don't forget to subscribe to the channel and press the bell button for updates on our video. Thank you for watching.